Hi, welcome. This is your host, Nurse Chioma. Thank you for watching this video today. I hope you're doing well. So if this is your first time meeting me, if this is your first time watching this, any of my videos, pretty much I am a registered nurse. I am also predominantly the founder of ChooseNursing.net, and I pretty much help people to pass their NCLEX exam, whether it is your NCLEX RN exam or is your NCLEX LPN exam. I can assist you with either one of them. So today I'm going to be talking about the truth about select all apply questions. The truth about select all apply questions. Now yesterday I did another video where I talked about what are, 3 major secrets about the NCLEX exam. And yesterday I talked about secret number 1. And today I'm going to be covering secret number 2, which is about select apply questions. Now, I would encourage you, if you think that this is information that people can find really helpful, then I would definitely encourage you to go ahead and share it with your friends and everything. So let's go ahead and talk about what is the truth about select apply questions. Okay, so you may want to take some notes, and if especially if you're somebody who is preparing for your NCLEX exam and you're trying to figure out how to pass it. And if you just joined, welcome, thank you for joining. Just let me know that you're here and say hello, and everything. I would love to greet you and everything. So anyway, so let's talk about select all apply questions, okay? Because here's the thing, I do a lot of surveys. A lot of surveys, and in the mix of the surveys, one of the things that people tell me, I hate select apply questions. Select apply questions, those are the ones that get me. Oh my gosh, I can't stand select apply questions. So I get a lot of that type of response from a lot of people. So I want to give you some insight today that will hopefully help you to better understand the makeup and how it's really integrated into the exam. Okay? And if you didn't watch the video yesterday, then I would encourage you to first watch the video yesterday, so that way you understand where I covered from the beginning. So anyways, as you know, at the beginning of the exam is really testing you more on content. Okay, so this is all really relevant. The beginning of the exam is testing you more on content. That's why when you first start the exam, the questions are easier. Then as you move along, the questions are now testing you on your ability to think more critically. Okay, so at the beginning of the exam, the questions are more about if you know the content. Then as you move along, it's more about your ability to think more critically, and that's why the questions become a lot more difficult as you move along. Now, here's what I found when it comes to this test. There are 2 major categories, right? Because we want to be studying for the exam by the NCLEX categories, and I talked about why in another video. So there are 2 major categories that's really testing you on your critical thinking skills, okay? And can you guess which one they are? That it is management of care, right? Or for the LPN exam, coordinated care. And then the other category is reduction of risk potential, right? Reduction of risk potential. So here's one of the things that I found was interesting, because like I said, I do a lot of research, and I was evaluating why is it that some people, when they take the exam, they'll get a lot of select all apply questions. Has that ever happened to you? Where whether it's you or a friend, and you took the test, I'm like, oh my gosh, I got like 40 select all apply questions, but so and so only got like 5. Why is that? Because remember, it is an adaptive exam. So here's the thing about it. What I've seen, as far as, like I mentioned, the categories that test you more on critical thinking are management of care and select all apply questions. So management of care, that's going to look like, who do you see first? Which patients are priority, that kind of stuff. And then reduction of potential, these, what I've seen, are more prone to the select all apply questions. It's not limited to, as far as the categories, but a lot of select all apply questions fall under reduction of risk potential. Why? Because reduction of risk potential is testing you on your ability to understand how to recognize emergencies. So that's why it seems more challenging, and that's why it's more about critical thinking. So the thing about it, what I've noticed is that when people say they get a lot of select all apply questions and don't pass, here's what that means. Your weaker point is critical thinking. That's your biggest issue. That's why you didn't pass the exam. Because your greater weakness is thinking critically. This is why I will see people who will get all the way to the end of the test, and they'll get all 265 questions, right? All of them, but don't pass. Why? Because based on the exam, it demonstrated that you knew enough content. That's why I kept on asking you more questions, right? Like it demonstrated that you knew content. But however, though, you didn't show enough strength in critical thinking. And that's why the exam didn't pass you. That's what I've seen, not for just one people, but for several people. And it predominantly, those are the ones who get a lot of self-apply questions. And they just happen to be weak primarily in management of care or reduction of risk potential. So moving forward, when it comes to the exam, whether it's your first time or especially if it's your repeated time, then it's a sign that you need to spend more time boosting and increasing your critical thinking skills in order to pass, in order to be successful. That's the thing about these select-apply questions. And here's what I say too, when it comes to select-apply questions, it's not as hard as people think that it is. The issue is that you're having problems with connecting. You're having problems with connecting, and the choices are not clear to you. And that's, once again, an issue with thinking more critically. So you need to change how you connect the information. You need to change how you process the information in order for you to really understand what is the question asking me? Then if you're asking those type of questions, then it's a sign that you're weak in critical thinking. And you need to build up your strategy knowledge base first before you take the exam again. Okay? Before you take the exam again. So I really hope that you really understood what I said from this video. If you have not, I would encourage you, watch this again. Listen to this again. Maybe you need to hear that aha moment that made you go, okay, that's what I'm doing wrong. That's what I didn't get. In order for you to really see it more clearly. So thank you for watching. If this is your first time watching, let me know that you're here. I would definitely love to greet you. And then also, please share this video as well, so that way other people can begin to learn this information. Because I know there's a lot of people who are frustrated, with setup questions. So this will hopefully help them to better understand what is that they're missing and what they need to do differently. Okay. Now, another thing too is that if you find this helpful as well, and let's say you are preparing for your exam, then I would encourage you to also join my free training. Join my free training, which is called How to Pass Your NCLEX Exam in 30 Days. In there, I go into a lot more depth, that I can only cover within a short period of time through these videos. I go into a lot more depth, and I really talk about, how to really structure and prepare for your exam and really open up your eyes even more so you know how to be successful. So I did put the link in the bio or in the video, but it is free NCLEXwebinar.choosenursing.net to sign up. So once again, thank you for watching, thank you for listening, and I'll see you very, very soon. All right, bye-bye.